Many thanks for staying with us. It's still the conversation, and on this segment we'll be discussing something very important, some kind of ailment that women have to deal with. We'll be shedding light on it, and because it is often, misunderstood, and this health condition is called endometriosis. Endometriosis affects millions of women worldwide, but many suffer in silence due to a lack of awareness and, of course, a lot of misconceptions surrounding the condition. Some endure severe pain, infertility, and a diminished quality of life without understanding the cause. But today we have someone, a medical practitioner, who will be making us understand this condition better, its symptoms, causes, treatment options, and the level of awareness of it here in Nigeria and, of course, Lagos. We have with us Dr. Dokuwu Adeleke Oyenoga. He is a consultant obstetrician and gynecologist at the Lagos Island Maternity Hospital. You're welcome, sir.
Yeah, thank you so much. Good morning.
You have such a very unique surname, Dokuwu.
Exactly. Very powerful name.
And it suits your profession as a medical practitioner. You're welcome once again.
Thank you so much.
Okay, we're trying to understand what endometriosis is. Let's start with the basics. What exactly is endometriosis, and how does it affect the female reproductive organs?
Well, thank you so much, presenter. When I sorry, it's very difficult for me to say Adebimpe. I know it's the culture,
it's Adebimpe.
Okay. Maybe outside I will be able to correct myself. Thank you so much, Adebimpe.
You're welcome.
It's not so convenient for me to say that. Well, when I saw the topic, understanding endometriosis, I was like, this is a topic or a condition that has remained very difficult even for professionals and gynecologists to understand.
Why did you say that?
And because the pathophysiology is poorly understood everywhere, despite enormous research on this particular condition. It still remains an enigma in the gynecological world. So, and of course, people have it, and we still have to do something about it. Okay. So it is generally poorly understood, and that has made the diagnosis to be difficult, and sometimes permanent treatment to be difficult, because if you don't understand how a disease comes about, sometimes it will be very difficult for you to know where exactly to direct your treatment. And endometriosis is one of those gynecological conditions that is a nightmare, let me put it that way, to the patient, relatives, and the gynecologist. And it basically means that, if you look at the anatomy of the reproductive organ of the woman, especially the uterus, that's the womb. So there are 3 layers: the outer, the middle, and the innermost layer. So that innermost layer is called the endometrium. So, and that is where menses comes from. Okay. So, and that particular area of the uterus is so unique that the way God created it, so it's so unique that most of the is responsible for most of the reproductive function of a woman. Getting pregnant, that is where pregnancy will implant and start growing, and that is where menses comes from. So when you now have part of those tissues, part of those tissue of the endometrium, that's the innermost layer, in any other part of the body, no, they are not supposed to be in any other part of the body. It's specifically supposed to be in that innermost layer of the womb. So when you now have it in the middle layer, in the outside that endometrium, so that is endometriosis. So, and it's present with a lot of symptoms, because as you are menstruating, you are having such menstrual symptoms in all other sites that you have it. Some have it in their ovaries, some have it in their pouch of Douglas, some have it in, it can be anywhere, in the tubes, in fallopian tubes. It can also be in the ligaments that are supporting the uterus. And while some also have it some elsewhere, the lungs, the brain, the
brain.
Yes, about was it 2 weeks ago or last week, we admitted I think a 29-year-old lady that had been convulsing every month. So, and then she convulses every month. So by the time they brought her to Oala Maternity, we discovered that she had
so it's not just restricted
so it's not restricted to the
uterus and the
no,
uterus.
it is not. So, and I've also seen somebody that is coughing out blood every month as you are menstruating. Anywhere we have the deposit of those endometrial glands, wherever they are, as you are menstruating, anytime you are menstruating, you'll be bleeding from those places too. Some have it on the umbilicus, the navel. So as you are menstruating, you are bleeding from the umbilicus too. So, and why some have it anyway, just even surgical sites, when you open up, probably somebody that have been operated before and they maybe has done myomectomy, that's fibrous surgery, or even cesarean section. So you now see that when she's menstruating from the site of operation. So and so it's a very difficult problem, and it abounds everywhere. Before now, we used to think that it is a disease of the whites, and that was because we do not have so much technology as at that time to detect some of these things. And then, but now with the advent of endoscopic surgeries, minimal access surgeries, and we can actually detect some of these things.
Okay, okay. From all you have said, I remember a while ago in one of the popular magazines then, there was a woman who had a case, and they thought she was suffering from witchcraft. Her palms, anytime she was menstruating, her palms too were always very red. So they said, she was suffering from witchcraft. It was a long. This was maybe like in the late 80s, early 90s. That was when it happened. So, from all you have said, can one now be able to talk about symptoms? Can one identify symptoms? What are these symptoms? And again, before a lady starts to menstruate, can one detect any form of symptoms? Are you born with it?
Well, thank you, Adebimpe, once again. And well, the truth of the matter is that endometriosis is usually confined to reproductive age. Okay. And when we say reproductive age, we are talking about maybe 15 to 50. And within those ages, after 50, we expect that the woman goes into menopause. So it's not so common in pre-pubertal girls. Okay. So in fact, I don't think I've had any case of such. That does not mean that it cannot happen, because we have actually recorded it in a postmenopausal woman, even though we don't expect it to be. So at least I think I've seen one person with endometriosis postmenopausal. So that is one.
What are the symptoms?
So the symptoms, when you have the symptoms, usually pain.
Like the cramps.
Pain. This one is even more than cramps. Is pain, as in serious pain, and that pain is before I even go into that, about 25% of people they don't have symptoms. It will just be there, and they are just it's not giving them any trouble.
They're not feeling pain.
They are not feeling pain, or even if they are going to feel pain, maybe just mild cramps, and that can be resolved with usual analgesics. So of course, such a patient will not come to the hospital because she can manage it. So, but pain, most of the time, when we talk about that pain, is pain during menstruation, serious pain. So, and that can be very severe to impair quality of life, and patient will begin to be absent from work, from school, and she won't be able to perform optimally. That is one. Then pain during sexual intercourse, and that is in about 70% of people. That is what brings them to the hospital. That's, of course, there will be there will be marital disharmony if you are not performing your duty as a woman because of pain. So marital disharmony and infertility, because frequency of sexual relationship will be reduced and the man will not be happy. So, and most of the time, that's what brings the patient to the hospital. Then you can also have pain, because if you have this endometriosis in other sites, like in the intestine, you can have pain during defecation. You can even be bleeding from there. You can have pain during urination. If you want to urinate, you'll be feeling serious pain and bleeding while you are urinating. That is if you have it within the bladder.
Bladder?
Yes,
bladder.
It can be in the bladder. Within the intestine, you can have bleeding while you are defecating. You can have pain while you are defecating. And even chest pain, cough, you can have it. And the way we now suspect it, because this pain is not something that is always there. It is cyclical. When you say cyclical, it comes during your menses. So if you are menstruating for 5 days every month, so you have all those symptoms during those period of 5 days. So after your menses stops, then pain can reduce. Then apart from pain, then you have abnormalities of the menstruation. Number one is heavy menstrual bleeding. So people that have it, they bleed heavily during menses. So they bleed and they can be admitted for bleeding. So and even be transfused. We have transfused people before. And I think was it not last year, we had one woman, very beautiful lady. She had this endometriosis and she's always bleeding. We admit her, we transfuse her, we drain. We did a lot of things for her. But her own was even from the intestine. She had from the intestine and it was really serious. So, and apart from bleeding, you can even have multiple menstruation, let me put it that way. You can menstruate today, finish it in 2 days time, then next week it starts again. And that time you can menstruate like 4 or 5 times in a month. So
and that person is constantly losing blood.
So we have anemia. Then part of what people what brings people to the hospital is infertility. Because
it is the desire of every woman to have children.
Yes. So, and endometriosis has a lot to do with infertility. Even though some people say it is really not affecting it or something, but we know that people with that have endometriosis have difficulty in getting pregnant. Yeah. So they have infertility issues and they come to the hospital. And there are reasons why endometriosis can cause infertility. So number one, I've mentioned one of it, that is reduced coital frequency because of pain. So, and if you don't meet your husband regularly, so the chance of getting pregnant is reduced. So, and this endometriosis can even destroy the tubes. So, and once the tubes are destroyed from adhesions, from when I say adhesions, I mean that the tubes can be plastered down with other structures. So it won't be able to move and block all the holes that the egg is supposed to pass through. So, and that's a serious issue. Then we can also have even the sperms. It can reduce endometriosis, can reduce the quality of sperm that is going in, because it's produced some antibodies that we just camp the sperm cells in one place and then kill everything. So,
all right.
So, and those are the few symptoms. And the other symptoms, like I mentioned, bleeding from the anus, if it is inside the intestine, then you can also be coughing every month and coughing out blood. Yes, and then you can have it even on the glycos. Yeah.
All right. You've listed scary things, and
scary.
They're scary, and
it's not scary, but it's what you see every day. So.
And you just talked about a 29-year-old lady. So we have younger women who are experiencing this. What are the treatment options for endometriosis, and then how expensive is it?
Well, the truth of the matter is that the treatment just like
is there a cure?
For now, there is no cure.
There's no cure. They don't even understand it.
There is no cure, but we just manage whatever we see.
Manage the situation.
So just manage the situation and try to improve the quality of life of the patients. So we can have expectant management. Like I mentioned earlier, that some people, they don't have symptoms, just in about 25% of people. So those ones, maybe when they ask them to do scan for some other ailment, they will just find out that there's an issue here. We leave those ones alone. They don't have symptoms, just leave them. So the other treatment options are, we can have medical and surgical. So, but the medical ones, the aim is actually to improve quality of life and also to reduce pain that is associated with endometriosis.
Not solving the problem.
No. It just, they come with a lot of pains. If you have seen this patient before, you will pity them. So the pain is out of this world. So you must be able to tackle that. So we give them analgesics, and sometimes there are some hormonal treatments that they get. So those hormones will create a sort of pseudo-pregnancy environment. So when you are pregnant, you won't menstruate. So, or a kind of pseudo-menopausal situation. So because when you are during your menopause, you cannot menstruate. So if you don't menstruate, then you will be free from those symptoms. So those are the things that those drugs will do. And they are hormonal, most of them are hormonal drugs. Like our regular combined oral contraceptives, we use it a lot. So, and they take it continuously. So because if you stop it, you are not solving anything.
Won't this also have a negative impact on the body?
Yes, some of them have. And I'm going to mention a few of those ones. So, and that's why you don't take them for so long. So you don't take them for so long. For the combined oral contraceptives, sometimes we give it for 3 to 4 months, and they take it, and it will just relieve the symptoms of pain and also excessive bleeding during menstruation. Then sometimes we also give progestogens. Those are progesterones. They are hormones too. So to help reduce the bleeding or stop the bleeding. So those ones will create an environment and as if the woman is pregnant. So if you are pregnant, menstruation will not come. At least you can do things and then live a normal life. So then the other ones that are they are like androgens. They are also hormones. So those ones, they are very effective, but their side effects, because of their side effects, we don't usually give it for so long. Even the GnRH analogs too. So some of them weight gain. No, that's number one problem of women. They I'm gaining weight.
I don't want to add weight.
I don't want to add weight. Well, you have to pick one. Is that to gain weight and then be free of pain.
About the surgery part.
So then so those are the issues. And then the surgery part. When you see it, because sometimes if you make a diagnosis, making a diagnosis is difficult, like I said.
Because I wanted to ask something on diagnosis.
Yes.
Okay. So,
but what we do is, before now, it's very difficult, but now people can do ordinary scan, and see that there is endometriosis lesions, especially in the ovary. So when you have endometriosis lesion in the ovary, so the ovary will be big, and you have some, to look cystic, and you have some blood inside, let me put it like that, inside that ovary, which is not supposed to be there.
To be there.
And of course, it is accumulation of old blood and all those things. So the color of the blood is not red. It's like chocolate. So we call it chocolate cyst. So when you see that, and there are features that you see on ultrasound scan, we just do a transvaginal ultrasound scan. So those ones will guide us that, oh, there's a problem here. So by the time you now go in, such a patient may require surgery, at least to remove the cyst, because if you don't remove that, patient will continue to have pain. So you remove the cyst and then lay it open so that it won't accumulate, because there is a higher chance of recurrence.
Okay.
So then the other one that we have now is endoscopy surgery, laparoscopy and all those things. So by the time you do minimal access surgery, put in your scope and your light source and camera, you can see the whole of the of the abdomen. You can examine the liver, you can examine the intestine, you can look at the ovaries, you can look at everywhere and see where these deposits of endometriosis lesions are. Then from there, you can treat. You can either burn them or cut them off. So by the time you cut them off, at least the patient should have some relief. So that's the advantage that we have now. At least we have a lot of centers, even in Lara Maternity, we have endoscopic suits where we do some of these procedures. That at least we have helped quite a number of young ladies.
Sorry, I'll have to cut you here. You know, reports just reaching us now is that there's another accident now outward Lagos on Kara Bridge. 2 trailers fell at Kara Bridge side by side outward Lagos, and traffic is already building. The trailer fell and dropped the container on the road, occupying about 90% of the road outward Lagos. Please, those who are applying that axis should be very careful and, you know, put this in mind. Sorry for cutting you there. I want to ask something about, you know, diagnosis. Some women see or have accepted painful period as normal. So is it possible that endometriosis could be misdiagnosed or diagnosed late, and could cause further problems?
Yes, thank you so much. Just like I said earlier, that people don't present to the hospital with the aim of saying I want to come and treat my painful period. Most of the times they come because they are unable to get pregnant or
conceive or have sexual relations.
Yes, or their sexual relationship is impaired or something like that. That's what they call. But very few people nowadays, we have young girls coming up and we can make that diagnosis. So like I said, when they present with symptoms, we can only suspect that I'm having painful menstruation. Is it related to my menses? Is it not? What about the bleeding? Is it much? Is it regular? Is it irregular? How bad is the bleeding? How bad is the pain? So we can suspect.
Okay.
But the main diagnosis is when you do histology. When I say histology, you are taking a little of the tissue of the lesion and send it to the lab. They will look at it under a microscope for us, and there are features they will see that will say this lady has endometriosis. Now, one of the reasons why that diagnosis is difficult is that I cannot just pick a lady and say I'm having painful menstruation. I say, okay, come to the theater, let me open you up, or something like that. So, and that is why this, and most of that pain is chronic pelvic pain. It's not something that we just is always more than 6 months or 1 year. So they'll be having pain and pain. So if you have such a patient, what we do is we bring her in and then do minimal access surgery for her, endoscopic surgery, look at the tummy laparoscopically and see if they have deposit of these endometriosis lesions. Once we do that, then once we see them, we can pick them and then send them for histology. So histology will confirm it for us that this is endometriosis. Then we can now begin proper treatment. But before then, because I'm a young lady that is trying to get pregnant or something, you can't just give them all these hormonal drugs that we say, you understand? So before then, we just give analgesics and then try to manage our psychology and also try to improve our quality of life. Then once we have our result of histology, then we can begin the proper treatment, which can either be medical, like I said, or surgery. So surgery can be laparoscopic or open. Sometimes we even open.
Do you like take out the womb?
Yes, especially in people that have had 1 or 2 children. And they don't need the womb again. We can take out all the womb, everything. Sometimes if it's as bad as involving the intestine, they can even remove part of the intestine and let the woman be. At least those are the things that we can do for them.
Okay, I want you to talk about lifestyles now for those living with endometriosis. Endometriosis.
It's such a long word. I have to practice again and again.
So talk about lifestyles that can also help with the condition.
Okay, thank you, Joy. But the truth of the matter is that the prevention is actually not possible.
You can't prevent it.
Because number one, just like I said, the pathophysiology is poorly understood. So in fact, the etiology, what exactly is causing this, we don't know. We only have theories. That's people propose theory that, okay, could it be because there is retrograde menstruation? Could it be because of some metaplasia? So when I say metaplasia, transformation of some other tissue in another part of the body into endometriotic tissues that will now begin to behave as if that is the womb. Could it be that? Could it be because some of the endometriotic tissue have been transported during menstruation to other parts of the body through the blood vessels? Could it be through the stem cell? A lot of things. Could it even be family genetic?
Is this hereditary?
Well, some have proposed that it could be genetic, but we know that part of the risk factors is family history. If you have a family, if you have a sister or a mother that such, there is a likelihood that you too can have it. So there is that. So and I think before I go to your question on the lifestyle, I think we need to discuss the risk factors, because those are the things you can really discuss to modify your lifestyle, and then probably will improve your quality of life. So all these factors to endometriosis, there are not many. So it's some people have said that if you are tall, you are prone to endometriosis.
If you are tall. Are these myths?
Well, scientifically, some people have proven it. Yes. That you are just prone to it. It doesn't mean that you are going to have it. So, and
if you are short,
I'm not tall. I'm not tall. I'm just 5'6".
Then weight. So reduce weight and also reduce BMI. So they are prone to having
reduce BMI.
Yes. So and if you attain menarche is if you start your menses early.
Because now we have little children. You see 9-year-olds.
Yes, if you start your menses early, so you are prone to it. Because you are going to have prolonged menstrual life. You are going to be menstruating almost for a very long time. So, and you are prone to that. Then if you have short cycles, maybe less than 21 days, so maybe like 20, 19, 18 days, so you are prone to it. And then sometimes they say if you take a lot of caffeine or alcohol, you can have endometriosis. So, but there are some things that can be done that said that reduce
endometriosis, like
yes, like prolonged lactation. If you breastfeed for a long time, so
okay,
it can reduce it. Then exercise.
Okay.
So exercise, when they say that if you exercise for greater than 4 hours per week, so that it may also help.
Okay.
So the other part is smoking. Some people say if you smoke,
that one is a forward fast.
But unfortunately, yes, it can reduce the risk of you having smoking. but unfortunately,
so are you encouraging women to start smoking?
Damage other organs.
Yes, unfortunately, the benefits of that outweighs the risk. Outweighs the benefit. So because if you smoke, you are your own. So but it's actually not good to smoke.
Okay, I want to talk about the stigma concerning women's reproductive system here in Nigeria. Most times women are being seen as when a woman has reproductive issues, they sort of stigmatize women. So how can women now get proper care for cases like endometriosis?
Well, thank you so much once again. Well, the care is actually holistic. When I say holistic, it's from medical to psychological and to family support. Because if you don't have all those ones, especially when your husband detects that that's the problem, and it's not, you are
Even
not getting
before
pregnant.
you get to husband,
family, relative,
spouse to be, husband
Yes, spouse
to be. Boy, I don't want to use the word boyfriend because your fiance. Thank you.
Yes.
Once they find out that this woman
it's always a problem.
As a condition,
they won't, they stigmatize them.
Yeah.
They won't marry. They just leave them.
In fact, I even have a case currently that one 25-year-old lady that the husband gave her ultimatum that she has to get pregnant by April. Is
it good?
I'm telling you, I said, okay. I said, please bring your husband to the hospital. Let him come and do his own test first. Let's even know that you are the problem.
Did he come?
He did not.
If they don't.
So that
Nigerian men.
Yeah, it's a serious problem. And but we just need to encourage our women that most of the gynecological problems are actually things that can be solved. That can be solved. But for endometriosis, unfortunately, we can just improve the quality of life and see how we can assist in getting pregnant, because infertility is a major issue. So, and unfortunately, even if a woman gets pregnant with endometriosis, there is high risk of miscarriage. So high risk of miscarriage and even preterm delivery. So, and those are problems too. So, and then that is why I said, after treating medically, we must try to address the psychological issues that the woman is going through. And in addressing that, you need the psychologist, because people can actually go into depression and be schizophrenic sometimes, and that's a serious problem.
So how can government now, and of course the medical community now, support in more awareness and ensuring that women have proper access to medical treatment? Yeah.
I asked if these treatments are expensive or they are cheap.
No.
Yeah. So now the treatments, they are actually not cheap.
They are not cheap.
They are not cheap. So, but what we are planning to do, even on the island, in the island maternity, we are trying to establish an endometriosis center. So where people with endometriosis can come, and so we don't want to say, we usually say people living with endometriosis, because it's not something that you can take away.
Exactly.
So you have to live with it sometimes. So people living with endometriosis can come and receive treatment. So what the government can do is to support that facility to establish such center. And I think we have gone past the paperwork, so it's just the implementation that we need. So government can come. Of course, it's something that will require a lot of investment. So because you need to upgrade your diagnostic acumen using the laparoscopy and others. So you need to do that. Histology is there, and you need to subsidize the treatment. So because, for example, now if I'm giving somebody GnRH analog, one dose is around 300 and the last time I checked, I think around 370 something thousand naira per dose, and you're going to have that for 6 months. So, and you can imagine what burden it will be on the family. And we all know what the economy is talking about now. So we need that government support to either subsidize the treatment and also the diagnosis.
All right.
So while we try to help our women.
Thank you so much, Dr. Adeleke Oyenuga. Donkuwo. Did I get it?
No. Donkuwo, yes.
You did not. We've had an enlightening discussion here today on endometriosis, and he has shared ways that women living with this condition can better manage the situation. Thank you so much for your time on the conversation. The conversation continues after this. Stay with us.